Well, Eli Lilly and Company is now on a mission to help people who have trouble hearing. Kylie Valletta here now with more in the business of health. Kylie.
Thank you, Gary. Lilly has agreed to a $487 million deal to buy Boston-based IUSM to develop gene therapies for hearing loss. The deal could increase to $610 million if the company hits certain benchmarks during various testing phases. The companies say the proposed acquisition will accelerate gene therapies that aim to restore, improve, and preserve hearing for an estimated 40 million people in the U.S. who are living with disabling hearing loss. The largest construction project in the history of the Indiana University School of Medicine is now underway. This week, IU leaders broke ground on a $230 million medical education and research building. The 11-story building will total more than 325,000 square feet in downtown Indianapolis.
This building will be a place where generations of future healers will begin their journey in medicine. And it's going to be a place where researchers are going to make innovations that are going to prevent disease, alleviate suffering, and save lives, not just here in Indiana, but across the nation and around the world.
The building will be the first new classroom space in Indy since the 1950s. The project will be co-located with the $2.7 billion Indianapolis Academic Health Center development planned by IU Health, which includes an expanded medical campus with a new hospital building. Some 200 Hoosiers with Alzheimer's disease or dementia are befriending virtual pets on tablets as part of an IU School of Medicine study. The animated cats and dogs work on tablets and are designed to help the person with Alzheimer's accomplish daily tasks.
I have an important reminder. Have you had a glass of water within the past few hours?
Yes.
Have you taken your afternoon medications today?
A San Francisco company called Care.coach created the technology. Hoosiers are testing the pets to see if by reducing the symptoms of Alzheimer's, caregivers have less stress, helping the person with Alzheimer's remain at home instead of moving to an institution. IU Professor of Aging Research, Dr. Malaz Boustani, says the pets have surprised even him.
I was very skeptic that this animated care coach developed by some person in California, will really do anything for my patients. Some of my patients early on, they come over and they'll tell me about, Buddy was really good. I've been talking with him, is really good. Or, she's really awesome, Julia, or whatever her name. And I'm like, who are they talking about? And my care coordinator, who support me in the center, said, no, Dr. Boustani, this is actually the avatar. This is the dog or the cat that they've been engaged with them. And they've been calling that avatar name. They talk with it. So that was the biggest surprise for me.
Boustani says scalability of the technology is key. It's low cost, doesn't require a healthcare professional, and the patient only needs internet access.
So this tablet is not artificial intelligence, right?
No, you don't want to outsource the care of your loved one. Yeah. There's a live human being on the other end of the tablet, and the technology converts the human's voice to the pet or to the dog or cat's voice. So really all you need is internet access, but it's not a robot, it's a human.
Fascinating technology. Thanks, Kylie.